Am I clear? If I start, no, utaambia. Just a minute. Okay, so I think we can now start our class. I hope you've joined. It's now 7:38. I've given you some time. Okay. Good morning. I think this is our topic 8, almost coming of course HIV and AIDS common unit. And today I'll be taking you through the following as illustrated. It's something I know we've all gone through. Some we've been mentioning them, but not all. At least for PEP and PrEP we've been mentioning, but now we'll look into them more deeper. We'll also go voluntary counseling and testing. We'll go through needle and syringe programs for drug user prevention. We'll also look at post-rep care. And lastly, we'll finish by going through treatments of HIV and AIDS, known as ARVs. Okay, so we can start. So what is PEP? PEP is what we call, it's what you're given after you've been exposed to HIV, also known as post-exposure prophylaxis. I observed something while marking your cards. Most of you are unable to, I'm sorry, but Madam Susan who is taking through the unit, so feel free to post your questions there. Once we are done with our class, we will go through the questions together. So my apologies for that. Yeah, so PEP, it's also known as, in full, is post-exposure prophylaxis. So some of you are putting here C instead of X, prophylaxis, it is X. So kindly, I was a bit merciful, but next time during exams, please write the right thing if you get such a question. So it's a HIV medicine taken very soon after possible exposure. That's why it's called post-exposure prophylaxis. And people are not, some of you're talking of 48 hours. No, you must take it within 72 hours, which is equivalent to 3 in case of any possible exposure to HIV. Maybe you had sex with someone, you're not, maybe, will I say it was not a planned one, or you're not, maybe you are scared, you're not sure. You had unprotected sex, not just protected, unprotected sex with someone. Maybe you're not sure of their status and you're scared. It's important you visit the hospital so that you can be given the PEP, also known as post-exposure prophylaxis. And sometimes, mostly doctors or anyone, you can be exposed to HIV and AIDS, like maybe when a doctor is attending to a patient and the doctor pricks the patient, and then by mistake, the doctor ends up pricking also him or herself. It's also advised that they take the drug because you don't know the status of that patient at that time. Then also through sexual assault, we normally hear these cases of rape case. Unfortunately, many people, girls, or I don't know if people, they also sodomize young boys. They don't speak out. Maybe someone who sodomized or someone who raped you, they threatened you. They told you, when you say this, I'll kill you. So you see, you get exposed, you get assaulted sexually, and you keep for a whole month. And then people start wondering why you have changed. And then that is the time you tell them you're exposed to, you were assaulted by someone. It is very late. Maybe you've already stayed for a whole week. Let's assume someone who, the person who assaulted, if they were positive, then you see they'll end up infecting you. So in case, but in case you're sexually assaulted and you immediately report, you'll be given PEP, so that just to ensure if that person was infected, you're safe to go. So I hope it's clear. You take PEP during sex, when you had unprotected sex and you suspect that person, your partner, maybe through needle, syringes, or any sharp equipment that can prick you or cut you, and maybe there is that sharing of blood, transfer of blood from one person to another, and then through sexual assault. So how to prevent occupational HIV transmission? We have said mostly the doctors, they're the ones who find themselves in this problem. The number two, through shared needle equipment used to inject drugs, or even in the hospital, mostly, because it's not easy to assault a doctor sexually unless you are a guru. So how to prevent occupational HIV transmission? One, as a doctor or anyone, maybe any caretaker, not just doctors, those people take care of aged people, and anyone that you're given at your care, kindly use gloves or goggles and other barriers when you anticipate any contact with blood or fluid. Secondly, wash your hand and other skin surfaces immediately after contact with blood or any body fluid. So use gloves, use those protective gear like gloves and goggle and other. Yes, Daktari. I hope now I'm clear. I'm sorry for that. Am I clear? I continue? Or anyone listening can type whether I'm now clear. Sorry for that. Am I clear? So that I can continue kindly. Am I clear so that I can continue? Are we back? Okay, we can continue now. Where were we? I'm sorry, it was a blackout, so we lost the connection and everything. We are sorry for that. So I think we were here. Yeah, he said first to use gloves and Google other barriers. Then secondly, we had said you wash your hands in case you come into any contact with any body fluids. It could be blood, it could be other form of fluids that come from people's body, maybe during wound dressing. Then be careful when handling and disposing of any sharp instruments. When you visit many hospitals, you'll see they have a bin written sharp objects. So be very careful while disposing them. Then use safety devices to prevent needle stick injuries. Then dispose of used syringes or other sharp instruments in the right container. Okay. I hope we are together. I'm also trying to see where we are so that I'm not leaving anyone behind. I hope you're on the other side, YouTube, you're active. Okay, so what happens if an HIV exposure happens at work? First, report your exposure to the appropriate person, and you're always told report within 72 hours so that you're given the pre-exposure prophylaxis. No, the post, I mean, because it's after. I'm sorry, you're given the PEP. So kindly, whoever will be on duty, report that you're suspecting you're exposed to maybe to HIV and AIDS. So they say better to prevent than to cure, because if you prevent, you'll just take the PEP they take for 28 days. But if you're to cure, you'll end up curing it for the rest of your life, because you have to be on medication from the day you realize you're positive until the end. I hope that is clear now. Okay, how long do you need to take the PrEP? As I've said, you take it for 28 days faithfully. You take it every day. And then you'll be required after the 28 days, you return back to your healthcare provider. They conduct some tests. And if they will still want you to come back after 3 months, they will let you know that you come back, so that they just do a last test to confirm that you're actually okay. So it's good that they confirm that you're well, that everything is now fine. Okay. How well does PEP work? PEP is very effective, and it 100% protects someone from HIV and AIDS if taken correctly, taken for those number of days. The 28 days, you take it every day correctly, it is 100% assured that if you suspect you are exposed to any form of HIV and AIDS, you'll be safe. So while taking PEP, it is important to use other HIV prevention methods. So you can imagine, suspected that you are exposed to HIV and AIDS, maybe during maybe in the health facilities units as you're attending to a patient, or maybe you had unprotected sex with someone, or maybe you are involved in anything that you suspect will have exposed you to HIV and AIDS, and then you go for PEP, and then you also continue with unprotected sexually. No. So even as you're taking the PEP, kindly avoid avoid scenarios that will still expose you to HIV and AIDS, so that the PEP that you're given for 28 days will carry out its work well. So in case there's any virus, it can clear. Because if you're taking it for 28 days, then in between you get exposed again, you see you're exposing yourself to more danger. And it might fail to work, not because PEP has failed to work, but because you are the problem. Okay. Other ways. So what are other ways of preventing HIV and AIDS? Choose less risky sexual behaviors. Avoid anal sex. I think it was in our previous units, we've talked about anal sex, which homosexuals prefer. But we said at the anal, the epithelial wall is usually very thin, so there is a lot of tear and shear during sex. And that's why in USA, those are statistics that was documented that majority of homosexual people in USA are HIV positive because it's very easy to transmit HIV through the anal sex behavior. So choose less risk like also use condoms. Just ensure sexual behaviors that expose you to HIV and AIDS. Also, vaginal sex carries a risk of transmitting HIV, though it is less risky than the receptive anal sex. I know we have, there's a question that you asked, why is vaginal, why are female more exposed to HIV as compared to men? It's how their vaginal organ is structured and how the receptive organ, the large surface area, it's normally very moist. So it creates a better room for HIV and AIDS, like for women to be infected. But even when all that is said and done, anal sex is now like 20 times worse than vaginal sex. Yeah, so avoid sexual behaviors that will expose you to HIV and AIDS. They say some people prefer oral sex, as they say it carries little to no risk because it involves your circulating in your mouth. Yep, I don't want to say much about that. Other ways of preventing HIV and AIDS: use condoms. Yeah, protect. If you cannot wait, if you cannot abstain, use condoms. I think that's why when you walk to all washrooms, we have condoms. So kindly protect yourself from STDs, the gonorrhea, the syphilis, and other sexually transmitted infections. Talk to your doctor about PEP. Taken daily. Yeah, even as you maybe you suspected you had exposed yourself to HIV and AIDS, and you go and you're given post-exposure prophylaxis. Kindly talk to your doctor. Let them know how you're taking the medication, how it is responding to your body, so that they may be of help to you. Okay. So other ways of preventing HIV, I think it's just a continuation of the initial point. Take PEP 72 hours after possible exposure. Another point, encourage your partner and yourself, go get tested so that you're able to know and if one of you is positive, you can be put into medication. Another thing, when you are aware of your current status, you'll take the right measures. You will make decisions that inform your future. If maybe one of your partner is positive, so that you're able to move on well. Then get tested and treated for other STD infection. Yeah, sometimes you just don't go and get HIV. You can go get tested for other sexually transmitted infections like gonorrhea and syphilis. You can go get tested. Another point, reduce your number of sexual partners. Kindly stick to one person. I hear people who easily jump from one person to another. Their chances of getting HIV and AIDS, it's very high. Another thing is this, as maybe you're moving to like 4 partners and they are all positive, it means the amount of viral load you are exposing yourself to is much as compared to someone who is just exposed to sexual partner. Choose the number of sexual partner, stick to one. The more you're likely to have a partner with HIV whose viral load is not suppressed, the more danger you are. So you don't know who you are maybe engaging with. Other points, decide not to have sex, abstain. Yeah, it's one of the best tool that I'll advise you to follow, because by abstaining, you will not worry about PEP. You will not worry about whether your partner is playing you. You will not have many worries. And then lastly, know yourself. Most of us fear, but it's good. Just go get tested. Know that you're okay, living well. By any chance, know that you have HIV and AIDS. Here, people nowadays don't fear HIV. People fear cancer and other diseases more. So when you know you're positive, you just get into medication to move on. Okay. Does PEP cause side effects? PEP, like other HIV drugs, ARV, sometimes they have side effects. You will hear, if you talk to people who take, some have different testimonies, some cause body weakening, nausea in some people. But those side effects, they are things that can be treated. They are not life-threatening. So, as we usually, when the doctor puts you in PEP for 28 days, kindly be making visits to your doctor. Explain to your doctor maybe what you're going through, what you're facing, the challenges, the effects of those medication. Then the doctor will advise you appropriately. PEP medicine may also interact with other medicine, because sometimes maybe when you're taking PEP, maybe you could be having blood sugar or other form of diseases, using other kind of medication. So as they interact, they could bring some side effects. So kindly go back to your healthcare provider so that they're able to advise you accordingly. I hope we are together up to there, and I hope I'm not fast. Okay. Can you take PEP every time you have a potential exposure to HIV? No. Don't use PEP as a escape route to living right. So that I also think this PEP is not easily available. So it's not, and I think if it is in the chemist, they must be selling them very expensive. Where you're paying for it, definitely to be expensive. But where you go and get it free, I think if you keep on showing up at the hospital every week, last weekend I had unprotected sex, then you come again next weekend, I had unprotected sex. No, that is not right. Yeah, so it should not be used. It should only be used as an emergency. We have said, in case of a sexual assault, maybe healthcare provider is afraid he's exposed to HIV while attending to the patient, or just maybe once in a while you had sex with someone and you are really afraid, maybe unprotected sex that is, and you are afraid that person was not safe. I think for me, I'll advise in other scenarios that I can advocate for someone to take PEP, though it's not in the notes. From my experience in campus, we have these freshers' nights. I think nowadays they are not there. During our where people go clubbing and they really get drunk, and you don't know, you realize in the morning 10 people slept with you, or even you don't know how many, but you can tell people slept with you. You see, you are not sure those who slept with you whether they were okay. So I think for me, I'll advise you, before worrying or before wondering and imagining how many they were, I'll advise you rush to the hospital so that you let the doctor know what went through. Then let them give you PEP, and then avoid such places, avoid such scenarios, so that not every time you have to think of how you can get PEP. Okay. If you feel that you might expose to HIV frequently, talk to your healthcare provider. I know there are people who actually given the pre. Yeah, there are certain kind of work, like chances of you being infected could be even 50 to 70%. So it's okay before you get into such places. They give you now pre, not post. They give you pre-exposure so that you take them in, so that even as you are attending to, whoever you are attending to, if you are exposed, then you are safe. Okay, so we have looked at PEP, the post-exposure prophylaxis. We have seen when to take them, how to take them, how to avoid case leaders to take them. Now we want to look into PrEP. Now this one is what you're given before any exposure, pre-exposure prophylaxis. So PrEP is not for people who are at a long-term risk of getting, it's for people who are at a longer term risk of getting HIV, either through sexual activity or by injecting drugs. As we have explained, these are people who being exposed to HIV, it's very high, 50 to 70% or even to 80%. And maybe it could be due to the nature of their work. So So that's why it is important that they are given this pre, so even as they are discharging their duties, they are safe. Their life is not endangered because of the nature of their work. Can you get help paying for PEP? We're talking about it should be both PEP and PrEP. If you're prescribed PEP after sexual assault, you may qualify for partial or total reimbursement. But you should actually, when someone who has been assaulted is presented to the hospital, they should be given this one. Actually, it's for free. Yeah, to be given. It's your right to be given, so that you're protected. If you're prescribed PEP for another reason and you cannot get insurance cover medical, there's a way you can be given and reimbursement can be done. So PEP like other drugs like ARVs, you should be given for free. But you see, we have reason as to why people buy this medication. Some, they are afraid to go maybe and take from the clinics. So they prefer going to the chemist, so that maybe they don't want people to know they are taking the drugs. So you see, if you don't want people to know that you're taking drugs, you won't go. You'll prefer to go and purchase them. Okay, if you are a healthcare worker who was exposed to HIV on the job, your workplace insurance or workers' surely pay for the PEP. Yeah, so these are services that actually should be available to people. Yeah, so we are done looking. PrEP has no PrEP as compared to the post. We've looked at post, we've looked at pre. I think in pre we didn't have so much to say because it's something. Pre is normally just given not to everyone, but to people who are likely, people who suspect in places that easily expose them to HIV and AIDS. And now, when you go back to our first slide, our other topic we want to go through is known as needle and syringe program for drug user for HIV prevention. When you visit places like Mombasa, you'll find out that many youths there, they really abuse these drugs. You'll find most of them sleeping during the day. They just look drunk. They've taken heroin, they've taken cocaine, they've injected themselves. And then you see something funny. When someone is under the influence of these drugs, I'm introducing this topic, needle and syringe program. When someone is under the influence of these drugs, they actually can't tell their mind. So they will share these syringes. Some government organization, they realized, okay, the same way we do for condoms, like we are telling people to abstain, but we know very few will abstain. Maybe the largest percentage will not abstain. So what can we do? Let's provide condoms so that even as people choose to engage in sex, we reduce cases of HIV and AIDS. So that was the same initiative that was actually brought up now to curb where HIV is transmitted through needle and syringe sharing. And that's when that program known as NSPS was brought up, known as needle programs for drug users for HIV prevention. I hope I've explained and you've understood. Okay, so what are the aims of that program? The program aimed primarily to reduce the transmission of HIV and other bloodborne viruses caused by sharing of injecting equipment by providing advice on safer injecting practices. Like these people who are carrying out this program or this initiative, they visit those people and they advise them on safer injecting practices. They will tell them like, don't share injections. They will also provide for them the same injections. They'll advise them on minimizing the harm done by drugs. As much as, they know these people are abusing drugs and they want to minimize the transmission of HIV and AIDS through sharing of this injecting equipment, but they will still go ahead and tell them, kindly minimize on using those drugs. They also advise them on how to avoid and manage an overdose. They'll go ahead and inform them on the safe handling and disposal of injecting equipments. They will provide them with these injecting equipments, tell them on how to use them, to handle them safely, and even how to dispose them safely. They will also advise them to go for testing. And if they are found positive, they'll advise them on the treatment services. They usually also go ahead and do some screening on these people to see whether they have the sexually transmitted diseases and other diseases like tuberculosis and even HIV and AIDS. They also help them by encouraging them to switch from taking drugs where they have to inject themselves and switch to other safer drug taking practices. And then linked to other HIV prevention interventions and free condoms, they'll go ahead and give them free condoms. And then if there are people who really need help, maybe some are already exposed to the infection, they make referrals to health care services. So these are people who really come in to see, we have people who are drug addicts and they mostly are abused through injections. So these are people who are already there. So what can we do? Let's advise them to minimize the harm done by these drugs. Let's advise them to go for testing. Let's advise them to get medication if they are not okay. We make referrals to other healthcare services. Let's provide them with other preventive measures so that they are able to help them and minimize the transfer of HIV done by this sharing of injecting equipment. I'll explain what is a psychosocial support. I took it from my last statement. Someone will not understand why when you make referrals to other healthcare. I'm sorry for that. Referrals to other healthcare services, wider psychosocial support and counseling. Someone will ask me what is psychosocial support. So psychosocial support addresses a person's emotional, social, mental, and spiritual needs, all essential elements of a positive human development. It's good to know that. Okay, so how we have said these programs or this initiative, they usually deliver syringes to these people and other preventive equipments or rather materials. So how do they deliver their program? First, they could be having fixed sites where they have a specific place, maybe located in a certain area. Maybe they have a room. They have a specific location where you are sure when you go there, and any kind of help in relation to the needle and syringe program will be delivered to you. Another way how they deliver their program is through mobile. They move. Some have these trucks that look like a house, a truck that has everything. And what they do, today they can go to Nairobi, they can go to Kangemi, tomorrow they can go to Ngong, they camp at Ngong. The other day they can go to Roysambu, they camp at Roysambu. People, they just don't go anywhere. Definitely they must have data where people are easily abusing drugs, or families or children who are easily abusing drugs. So they just don't go anywhere. They must have a specific place where they're sure there is a need, they go there. Also through outreach programs, they take many forms, including mobile units, parking services, which are delivered on foot and at street level. They have people. You sometimes see some people walking with some bags or some containers, having all this material. They visit specific people. They speak to individuals. I think for this outreach program, I've seen it even with people who conduct HIV tests. They come to people's home, have one-on-one with you. They talk. Maybe they ask you if you can be tested. They counsel you. So they do the same. And then syringe vending machine in some developed countries. they have a machine so that people know the specific locations of these machines. You go put your coin. In return, the machine gives you the syringe. And some in the pharmacies where you go and buy them. I wonder, in pharmacies, they have to sell. They don't give for free. Yes, I hope that is clear how this program, either through fixed sites, they're located in a specific place. Like, when I go to Afya Center, they are there. When I go to, those locations. If maybe I go to Ezakwalton, they are there, like that. When I go to Magunas, they are there. Or some are mobile, they move from one place to another. Outreach program, they do like door-to-door evangelism. And then syringe vending machines, we have automated machines in this developed country. You put your coin, you get your syringe, and then in pharmacies where you buy. Okay, I think this is our second last topic on voluntary counseling and testing. Short form is VCT. Each letter has a meaning. One, it is voluntary. That no one should tie your legs and your hands and throw you in a boot and take you to the VCT for testing. No, it should be a personal choice. You decide that I will go and get tested and you go. That is why it's voluntary. It's counseling because they should perform a pre and a post testing. If someone asks you to describe maybe the process that takes place at the VCT, that's how you start. It's voluntary. First, it's someone personal initiative to go. And then while you are there, they must first conduct a pre-test counseling. They have to talk to you about HIV and AIDS, scenarios when people get exposed to it. Then they tell you they will conduct a test on you. They tell you they will read results to you. And they tell you in case it is like this, like they have to psychologically prepare you and show you like it is not a death sentence. It's not a matter of life and death. They have to really counsel you well so that even as they conduct the testing on you, you are set. You are at ease, you are at peace. And then now they conduct the actual testing. There are so many ways. We have the rapid test, the one done with molecular machines where HIV antigens can be detected with the antibodies in the machine. We have this other test where they normally put your drip can be read. It's normally very quick. And even nowadays, things have really changed. In the long time ago, they will tell you when you come for testing, like maybe on January, they tell you come after 2 to 3 months. But nowadays, we have automated advanced machines that can tell if you have. Even if you're exposed some few days ago, it can tell. Like those machines, they don't require 2 to 3 months to show that you have. If you go, they can tell if you have or if you don't have. And then once they have conducted the testing, now they're supposed to give you the results. They should now do a post-test counseling regarding what I've observed. If they are sure you are negative, they usually don't say much. They'll just show you the results and they wish you all the best. If they realize you're positive, they have to do a counseling. They will have to tell you how to live with it, how to be positive, how to take life positively. They will advise you on starting your medication immediately. Like, don't waste time. Start your medication now. And that is all under voluntary counseling and testing. Yeah, so it's either you get positive test indicating that you have HIV, meaning the virus has been detected, or you are negative, you don't have HIV, the antigen, the foreign body, the virus has not been detected. So that's all. Yeah, that's what I described. It's either you are negative or you're positive. Yeah. So just some few questions. Are results private? Yes, they should forever be private. How long will I need to wait? Things have changed. Nowadays, get your results so fast? Where can I get a test and counseling? There are so many institutions when you visit, almost all hospitals, and then VCT. Like I know just after Kennel, we have one opposite level 5 where you go get tested. Okay. Now we are here. We have gone through the needle syringe program. We have gone the pre and post steps, pre and the PEP, pre-PEP and the PEP itself. We've gone through the voluntary counseling and testing, and now we want to go through post-rep care. So all these topics, as you can see, they revolve around HIV and AIDS, transmission, infection, and prevention. And just to mention, like we had that question, we were discussing, they were saying at, I don't know, it was design or put up a program for men. Yeah, educating them on HIV. The most important thing to talk about while coming up with such programs are measures of how is HIV transmitted, how is HIV prevented, how is HIV, the measures of treatment. Those are the things you bring out, the social impacts of HIV and AIDS, and that's so those. Anytime you talk about HIV, look at it all round. The transmission, how is it transmitted, how is it prevented, how is it treated, such things. Impacts. Those are the things you focus on. You can educate people on. Okay. So post-care, we said there are people who get sexually assaulted. So what should happen? Survivors are supposed to report within 72 hours because we have said PEP can only work within 72 hours of a possible exposure to HIV and AIDS. So within 72 hours, it's when you should report the matter. Don't stay for 1 week and then go. No, please, within 72 hours, you go and report. Health play a critical role in collecting evidence. You have seen, we have these people who have they've been arraigned in the court to answer cases. They've been accused of raping minors. And you see, sometimes it is difficult if we don't have evidence. So they normally say this: when someone has been assaulted, don't start washing them, take them to the hospital like that, so that they can take evidence, the forensic evidence, they can swab and everything. It will act as evidence, so that if tomorrow they say, if that man denies, if the man is arraigned at court and he denies that I am not involved, they'll take his specimen, they already have the swab from the lady or the child or the minor or anyone, even a boy who has been sodomized. You know, sometimes we talk so much about girls and we forget we have boys who are also sodomized, and they can perform a test, and they will perform molecular tests, and they can tell whether that man or that woman assaulted that minor. So healthcare provider here, they play a very critical role. That's why for me, I think it is important immediately you have a sexual assault case, first go to the hospital, get the PEP, get the evidence, let the healthcare provider collect the evidence, and then later on, now go to the station to report the case. Because it means you have started from the right direction, you've been treated in case of any possible exposure. Secondly, you have also evidence has been collected, and now you can now go to the police. That evidence will also help the police. Yeah. Okay. Why does this comprehensive post-rape care remains inaccessible to the majority of rape survivors? We know we have so many people who really get exposed to such incidents. We have had many cases. I think we cannot even count. Every year when you listen to news, a teacher assaulted. Nowadays, very sad news, a preacher, we hear a pastor is assaulted. It's so sad, but we can tell the so rampant. But why do these services the post-rape care services still remain unlimited. One, we have limited availability of services. The government has not put so much, it has not pumped so much money to this service. You can even see the current crisis in hospitals, general hospitals, no medication. So you can imagine if we don't have common medication for people who visit hospital every day because they are sick, then when do they even put up such services for people who are raped? Another thing is stigma and insensitivity faced by survivor. Yeah, like in many scenarios, you find when a man rapes a young child or vice versa, they threaten them. Like, okay, even leave alone that. First, you're like, if I tell them that I was raped, how will people take me? That stigma already is there. They will judge you. Some think, I don't know, say I was unfortunate to listen to a certain case from someone I knew who she was raped by the father when she was young. And we told the mother could not believe. And the mother told the child, you are who seduced your father. You can imagine when now, and I'm just, according to me, the child was telling the truth from our one-on-one. The child seemed to be telling the truth, but the mother is now taking sides and protecting the father who raped the child. I'm sorry to say the father was positive, and that child was being positive. It's a sad story, but it's a real sad story. So you can tell that child, I know, maybe regretted why she shared it with the mother. Instead of the mother embracing the child, the mother thought the child was indeed the major problem. Also, a lack of information and awareness about the services. So, yeah, you find in these rural areas, mostly, even in urban, people are not even aware. I'm sure maybe some of you are now in first year and you're hearing this for the first time. So there is lack of information. Maybe such a topic, such program should be really emphasized from class 1. Yeah, they call it Roma nowadays. Yeah. Another thing is delays, poor police procedures. Yeah, you can. We are living in a very corrupt nation, corrupt times, and sometimes even the same police can be used to tamper with the evidence. So sometimes maybe they don't take the matter so seriously. As they take time, they interfere with the evidence. Then sometimes you have limited coordination between police and medical services because mostly these people first visit the medical services and then now they go to the police to report. So there is that poor coordination. And then lastly, lack of funding allocated to these services. Yeah. So I think this is the last bit of our today lesson. HIV and AIDS, taking ARV. When does it start? It starts immediately that day when you visit that hospital. They perform a test on you and it turns out positive. They will always advise you to start your treatment immediately. One, it doesn't matter how long you've been having HIV. They won't care whether you've been doing it for the last 3 months, 1 year, 10 years. They won't care the real load that you're carrying by then. They will put you immediately on treatment. That is what they do. So HIV treatment involves taking medicine that reduces the amount of virus. So what ARV don't like cure you from HIV, but they reduce the HIV and AIDS virus. There was a question that asked, at what point can someone who is HIV, sometimes it's good to I always tell my class group, always underline the key points or the key words. You've been told, at what scenario does a HIV positive person at what point don't they transfer HIV to other people? Already this person is HIV, the word is HIV positive. So it means one, the only scenario they don't do this is when they're under treatment and they've been able to suppress the virus. It's less than 200 copies. You see, at that point, the viral load is undetectable, and therefore they cannot transmit even if they had unprotected sex. Secondly, this HIV person who is positive, that is the keyword, when they have sex with someone else and it's protected, they will not transmit. So be very keen. Always look out for the keyword so that you don't miss out. So these treatments just reduces the viral load. People who take these heavy treatments faithfully, you know, the good thing is that statistics have proven people are able to reduce. When you go back for testing, you negative, and you're good to go because the viral load is so low that cannot even be detected. Yeah, no effect for HIV, but with medical HIV, taking HIV medicine does not prevent transmission of other sexually transmitted diseases. When should I start treatment? Immediately. What if I delay treatment? Yes, virus keeps on replicating. You are taken to how virus behave, HIV and immunity, how the virus attack the immune cells through the CD4 receptors, how it gets used by the membranes, it gets into your cells, the cytoplasm, and reverse transcription takes place. The RNA gets transcribed to viral DNA, and then once it has been transcribed, it now integrates to your DNA. Now your immune DNA, then it makes many copies of itself. Once it has made copies of itself, the cell's rupture releases the viral particle, and those viral particles that are released, there are many. They infect other cells, and it means they continue multiplying, infecting all your immune cells. It comes to a point your immune cell has been destroyed, and now you develop to AIDS, the infection stage. So if you delay, that is what happens to you. When should you start? Immediately. Okay. Treatment reduces the amount of HIV in the blood. So the amount of HIV in the blood is called the viral load. I think whatever I'll be reading, I'm just repeating what I've explained to you. So taking medicine will reduce this viral load, and your CD4 cell count will be high. Definitely. If your viral load will go down, the CD4 cells, the immune cells, the lymphocytes, the monocytes, the macrophages, the dendritic cells, I know Dr. Mguero took you through that, they will go high. And therefore you'll be good. And then you'll go to a point where you have less than 200 copies of HIV per milliliter, and you'll be safe. You'll be healthy, you live your life well, you're good to go. HIV medicine can make the viral load so low that the test cannot even be detected. It's called undetectable viral load. If your viral load goes down, you're starting HIV treatment, that's treatment. So continue taking your medicine faithfully as prescribed. So if you skip your medication, you are giving HIV a chance to multiply around. That's why in cases people who have drugs and they will get taking the medication, they skip. I have heard when you take these medications, you fully remember every day, and you'll be able to go. Yeah, so just keep. I hope that, yeah. Treatment helps prevent transmission. As I've said, these slides, I'm just repeating what I've explained to you. So if you take your medication faithfully, your viral load goes so down, it will not even be detectable. It's called undetectable, and therefore, even if you are having unprotected sex, you see when your partner will still be. Yes, so having undetectable viral load in preventing transmission. We don't have whether having an undetectable viral load prevents transmission through syringes. We have not conducted the statistics on that. When it comes to science, we don't rely on theory. Like we have to perform research on people. Like if we want to know whether someone with undetectable viral load can get HIV through sharing of syringes, we have gone and look for people who are positive. 1, they have been taking the medication rightly. 2, they have undetectable transmission. 3, and they share the syringes. Then we can tell. So you see, we cannot guess, but at least when it comes to mostly the sex, the study has been done. And that's why you find so many people who are taking medication and they're living well. And the partners are okay. The negative is living with the positive who has undetectable. It's only that they still call it undetectable viral load. When you go for testing, you'll turn negative because they cannot detect the virus. So having undetectable viral load also helps prevent transmission from mother to baby. Yeah. If a mother with HIV takes HIV medicine throughout the pregnancy, then delivers and gives HIV medicine to her baby for 4 to 6 weeks after birth, the risk of transmitting HIV to baby can be 1% or less. Hope that is clear. So having undetectable viral load is very important. Taking treatment as prescribed, drug resistance. Yes, so when you're taking these drugs, you have to be very, very disciplined. You have to stick medication, take them faithfully. Because just in case you're not aware, ARV are different types. So don't start taking, virus keeps mutating. That's why we talk about resistance. The same to antibiotics. When you're given today penicillin and you don't finish, then tomorrow you get a similar infection, you're given penicillin. It will not work because the bacteria in your body they mounted a resistance. Same to this virus, ARVs. So take them faithfully to avoid developing drug resistance. Does HIV medicine cause side effects? As PEP, it does. Some people experience vomiting, nausea, headache, dizziness, rash, fatigue, pain. Yeah, but you have to bear with it. Go back to your healthcare provider. Will HIV treatment include my hormone therapy? Okay. They say there are no drug interaction between HIV medicine and hormone therapy, but you're always advised to talk to your care provider if you're worried taking the medicine. What if my treatment is not working? Go back to your healthcare provider, let them know that your medication is not working. They will advise you accordingly. Okay, still my treatment, it's hard. Yeah, I hear people who take these drugs sometimes at first not easy, heavy on you. So go back to your healthcare provider. The key point, always up there. Let them know you are struggling, like you are struggling to adhere to it. Maybe you're you're having side effects so that they can help you accordingly. Talk to your healthcare provider about problems taking your medicines. Problems taking pills, the side effects that you might be going through, and the treatment. It's just a repetition to emphasize. In case you go through any challenges while on medication, please always go back to the healthcare provider. Let them know that you're having challenges. Let them help you. Let them know you have side effects. Let them assist you. Let them know you have fatigue. It's hard for you to adhere to these drugs. They'll advise you accordingly. Sometimes they usually even change the treatment for you. They give you a different type of ARV. Plan ahead. They always say when you stick to a discipline schedule, you are okay. So sometimes most of us, we are busy, you will forget. So always ensure you have an extra, if you have your car, have some extra or in your bag or in your working place, so that if by any chance you forget to take while at home, you can take while at your car or where you work. Always plan ahead. I know during Corona we had a crisis because the drugs were not coming through. So always ensure you have extra medicine with you, maybe to take you ahead some extra month or 2 months. Don't wait until they are over before you go to collect. Find help for mental health or substance use disorder, being sick or depressed. Sometimes it's something that not everyone takes positive. Those who take it positive, they really move on. We are all testimony of, I don't know, she's called Susanna, a lady who came out and she's been sharing her status. She's fine. She's having a family. Not everyone is like that. So some are going to be depressed, mentally disturbed. Please go to healthcare provider. They've been trained to be understanding, to encourage you throughout the journey. If alcohol or drug use, sometimes they'll advise you to stay away from drug abuse because chances are high. We have read in the past that alcohol destroys the liver, and the liver has the enzyme that breaks down or digests or RV drug. So it means it won't function well. Also, when you're drunk, you forget to take your medication. So they'll advise you to leave. And finally, talk to your healthcare provider if you miss a lot of doses of your medicine. Missing a dose, kindly, it's just a repetition and emphasis. Back to them, let them know you've been missing your doses, let them advise you and guide you accordingly so that all will be well with you. I think that is the end of the topic. Feel free to ask questions. I'll move now to the YouTube chat to see your questions. Thank you. Okay, I have seen some asking whether RKS can occur with them. Yes, it does occur. Some men are also, they can be raped by fellow men, they can be raped by women. It's only that I think in the past we've been putting so much emphasis on the girl child, but it can also affect the boy child. So even the boy child, will visit the healthcare provider so that you are actually okay. Thank you. The lesson was good. What is the relationship between HIV and AIDS? That question was there. Differentiate between or discuss or explain HIV and AIDS. HIV is the virus. We're talking about the virus, and the AIDS is the infection. So if you do load, you'll move now the acquired immunodeficiency syndromes. Now you've exposed your body, your viral load is so high, they've destroyed your immune cells, and your body cannot fight any infection. Anything that comes will just go with you. Tuberculosis, any form of infections. That state, and that is the most dangerous state. I think that is the state we call full-blown stage. The question, how can one create awareness for the program? I explained while I was teaching. I think when they'll be returning the card, I request them to take the same, but we have said the program should focus on how HIV they transmit. Discuss, we organize that program, discuss how HIV is the prevention, the treatments, the impacts, the social impact. Generally, you focus on that. Yeah, in Swahili Kitambo, why I was saying, I'm sorry, we had a blackout, so we took some time, but we came back. So thank you for your patience that you did not log out. Thank you. This one was good. Can HIV affect people having blood with? Yeah, please don't go messing around. It affects anyone. Yeah, kindly. Yes, thanks, madam. Thank you for the nice lecture. Questions today? If your man have unpredictable viral load, can you have a baby that is HIV negative? It's not unpredictable, it's undetectable. Yes, if you have undetectable viral load, we have seen, even if you have unprotected sex, you will not infect the negative mother, so you'll have a healthy baby. I have answered. So it is not unpredictable, it is undetectable. It cannot be detected in the blood while testing. Thank you. Great lesson. What percentage can you guarantee that PEP will work? PEP will work 100% from what we have read and what I have heard, what I've seen. As long as you take it faithfully for 28 days without skipping. I know there's a difference between P2 and PEP. P2, there are those medications I think people take when they don't want to be pregnant. Yes, they usually take it after sex. PEP, we have talked about PEP. Post, after you suspect you've been exposed to medication. Okay. Thanks for the lesson. What should someone do time enye unapata simu inakwambia create channel do post kwa public chat? I think that one I might not be able to assist. Kindly, you can always the IT people and you ask them, they will assist you. Wow. I'm looking for questions. Cut 2, you'll talk. I think your lecturers today will discuss with you whether to have a sitting or an assignment. My group G, let's meet in class, and the rest of you meet your lecturers unless they have said otherwise. Is it true that newborn baby HIV can be cured through medication? From what I've read, they say if a mother who is positive gives birth to a baby, you see, what happens, they know mothers who are positive, they're allowed to breastfeed their children, but only under treatment. So what happens, that child is put into medication for 4 to 6 months and they'll be fine. Yeah, they'll be fine. You know, it happens like immediately. So, yeah. Thank you very much, madam. It's there cut 2. I think today, when will we get our scripts? You'll get them, don't worry. Yes. Continue revising. Thanks, Sana, Jerry. I think we are done. Okay. I think, yeah, we are done. Thank you for your. It was long. I expected. It had 34 slides. I didn't see the need of split to an extra week, but I know it's been clear to you. I'll advise all of you to take care and to as well for exams. It's just around the corner. Kindly, and always be, when you get option, underline the keyword and all will be well. Who was taking you through? I'm Susan, and have a good day. Thank you. Bye. Okay, I'm hearing some questions. I have checked through. I can assist the comrade who needs to access public chat. Yeah, thank you. Someone who had an issue with accessing public chat, see Muriuki Charles Macharia. He will assist you. Is HIV found in blood or lymphoid cells? The lymphoid cells, these are the immune system cells. The lymphoid, they manufacture the immune cells. So definitely the immune cells are found in the blood. And the reason as to why they normally take your blood, it's because your blood has those cells, and that's how they're able. You see, when you have HIV infection, the viral particle will rupture, release to the blood, and then they'll be moving through the blood, infecting other. So that's why they test it in the blood, because it will be in the blood before it starts infecting your immune cells. Is there a relationship between HIV and hemolytic disease of newborn baby? No. There is no. That one you can read broadly on it, but there is no relationship. Is it advisable to take PrEP before sex and PrEP after same sex? Silas Poison. I think for why put yourself in that pressure of taking before and after? No. When you're given PrEP, we have said that PrEP is not given to people mostly to people who are exposed. You see, people who are exposed to HIV, maybe because of the nature of their work, so not because of sex. Yeah. Mostly people who normally take after sex, they take PrEP. Yeah. Thank you for the nice lesson. Thank you. Can we have HIV vaccine? We are hoping so. Science keeps on growing every day. But there are so many things, I think, for me that surrounds this HIV medicine thing. But we are hoping for the best one day. Answer me, madam. What is the question? Thanks. Nice. Thank you. Thanks for the left. Which question? I hope I've answered. Lek, umesema visitiko karibu na Maguna Zama. I have not said that. When I mentioned Maguna, I was saying we can have those fixed needle syringe program in a certain place, like Maguna is a Qualton. The VCT in Embu is opposite level 5. Yes. Yeah, I think I've answered all of your questions. I hope so. In case there's something that was not clear, please ask your leaders in your class. They will assist you. Bye, and have a great week ahead. Thank you.